Castle.
My Lords, in response to the front bench contributions, the Noble Lady the Minister said, "We don't have evidence of the reason for these disparities." I'm sure she's aware of the report published by Citizens Advice in June that nearly 1.4 million people in the UK have no access to welfare payments because they have no recourse to public funds status. Research conducted by the Migration Observatory at the University of Oxford found that no recourse to public funds falls disproportionately on people in the BAME community. 82% of people helped with a no recourse to public funds issue by Citizens Advice in the last year were from the BAME background. People with no recourse to public funds have difficult choices, have to risk exposing themselves or simply having no money. Is there not clear evidence that no recourse to public funds is discriminatory, indeed is structurally racist policy? Further, does the government have, or is it planning to secure, data on the death and infection rates for people with no recourse to public funds compared to otherwise similar individuals?
My Lords, Noble Lords will have heard me earlier today make reference to the fact that in relation to free school meals, children of many who have no recourse to public funds have been able to access that, and the furlough scheme and the job retention scheme were not counted as public funds, so that those in the category the Noble Lady outlines were able to access those. No one in this country is charged for testing or treatment for Covid-19, and certain services, including primary care and A&E emergency, are free to all, and it's very clear that if there are charges to be applied, treatment that is considered by a clinician to be urgent or immediately necessary must not be delayed or withheld. So we have made the essential healthcare available to all people who are within the boundaries of our country.